Hi, it's Celeste Majors, your canary in the coal mine. Today I wanted to talk to you about, let's see, what should I call this? You have time to think after the diagnosis. A few months ago, I went to my doctor just to get my prescription, my checkup and my prescription refilled for my thyroid supplement. And she was a new doctor. I hadn't seen her before. And she started telling me, oh, catastrophe's on the way. And started to try to hustle me into procedures and medication and stuff like that. And I just went, whoa, 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 whoa. Let's just refill my prescription and I'll look into this. So that's what I wanted to tell you. There is I don't know if it's deliberate or what, but it's like some doctors like to make everything into an emergency. They'll tell you something that's a brand new piece of information for you, and they'll try to get you to have surgery or whatever within a few days. And they'll make it sound like it's dire that you have to do this right now. Well, the truth is, most of the time you have some time to think. You have some time to do some research. You may have some time to be able to go get some other opinions. Your heart condition or your diabetes or your whatever didn't arrive in your life yesterday. Your tumor even didn't arrive in your life yesterday. It takes decades of miseating, of misliving your life, of maybe you had a genetic disposition too, for those situations to arrive. I mean, they say that, for example, a breast tumor is normally in place and growing for 10 years before they can detect it on a mammogram. So the day they detect it on a mammogram, you don't have to have surgery the next day or 2 days later. It's been in your body for a long time. We've all got tumor cells in our body, and it's all about how well does your own immune system take care of those cells. So you have some time to think about these things and to research them and look at them. Don't let yourself be stampeded into doing something quick just because they have an opening in their schedule. I just think that's so unfortunate that doctors use what feels like scare tactics to they hit you with some really bad news, and then they tell you got to have it done like tomorrow or the next day. That just can't be true because it's been in your body for so long. And so you do have some time to research alternatives, research how you're going to approach this problem. One of the blessings in my life was that oh gosh, this was 30 or so years ago. I was about 30, 35 years old. And something showed up on I had a small breast lump or something. And the doctor immediately, we gotta do this. I'll have to send you for a mammogram. Well, in those days it wasn't that easy to get a mammogram. So it actually he had to wait 3 weeks before I could get into the schedule for the mammogram. And I didn't realize what a blessing that was, that it was not possible for him to get me in sooner for that mammogram. Because in the meantime, I could do some research and I could find out about what are the consequences. If he says it's, I have to have surgery, what's the consequences of that? If he says I have to have radiation, what's the consequences of that? I happen to know a woman at church who had this big swollen left arm because she'd had her breast taken off, and they'd removed all the lymph nodes on that part of that side of her body under the arm, and this big swollen arm that was useless to her, that she had to carry around in a sling, was a result of having that breast removed. And I remember that this was back in the 80s, and I went back to the doctor and I said, well, if we have to do something, what I want is just the tumor taken out. I don't want a full breast removed. And he just glared at me. He says, well, I don't do that. If you need to have a surgery, then we're going to take off the whole breast. I says, well, then you're not my doctor. Because I've been reading about the fact that you could have a lumpectomy combined with some radiation and have just as successful of an outcome statistically as if you had the whole breast removed. So that's what I'm saying is, when you're hit with a negative diagnosis, especially a big order of magnitude, you need some time to be calm, to think, to research things, to talk to people, to get second opinions, to maybe take some additional tests or, whatever. Don't allow yourself to just be stampeded into treating this as if this is an emergency. This is not a car crash. You're not bleeding to death. You've had this condition for a while, so think about it and do your homework before you allow so you can make a clear-headed decision about what you really want to do. So that's what I wanted to say for today, and I want you to get well and stay well. Thanks.